All right. Well, welcome back. Today is Friday, the 24th of April. It's 12:30 in the afternoon. Chief Paul Tomasi, myself, Chip Rarick, your city administrator, and practicing the art of good government, which is communication. Not a whole lot new to report. It's been a rough week. It's been a rough week, Chief. I can tell you. I've really been working on developing a plan with some of our partners and some of our regulators at the county and the state on trying to reopen certain industrial elements of our community, and it's not gone well. We have unfortunately people in our community who are suffering because of the inability to get out of their house, their properties, because of some of the restrictions. So we're working on that in a trying to be genteel about it with some of our regulators. So we're also looking to recover with some of our partners and the partners who are being very, very proactive. You maybe heard me talk about this, is our restaurateurs who have some great plans that they're developing, the innkeepers, our friends in marketing, numerous different, the construction industry certainly. Dick Bauer's been trying to work on that, leading that charge to some degree as well. And again, what we're doing, I think, as city managers on the peninsula, not trying to be divisive, but we're trying to develop a reopening plan for the peninsula itself. So, but again, not a lot of progress this week. It's been a rough one. So one note from firefighter paramedic Dave Jednick. He reports that he's heard that some people are not going to the hospital. They're having non-COVID symptoms, and they're concerned about going to the hospital for fear of catching the virus.
Correct.
And that's not a good thing. The hospitals do have protocols and precautionary measures in place to prevent any transmittal, and they're able to treat you. In fact, they want to treat you for your ailment. So if you have chest pain or something, please call 911. Go to the hospital. Don't delay for fear of catching the virus. So That's what I had, sir. What do you have for us?
Well, to piggyback on that a little bit, that's a conversation I had this morning with our paramedics. We had a tragic incident last week where a patient, not from our city, just outside, didn't call because he was concerned about going to the hospital. And in fact, he should have gone a couple days earlier. Again, don't be afraid to go to the hospital. There's always has been sick people there, and there always will be. And they're prepared to help people. They have people isolated who have the COVID. They have an open area. The hospital actually is as least populated as we've seen it in years. Yeah. There just aren't many people going there. So if you need services, still use them. That's an important factor.
And certainly community hospital has a very, the whole architecture and design is a very open hospital. It's not a traditional multi-story enclosed building that you would see in other areas and cities. So
yeah, correct. So maybe I'll segue a little bit into what we're seeing countywide, and part of our conversations this week with the county and the county health director is this rate of increase that we're seeing. Our update today was 164 positive cases in the county. And again, we started with our first case on March 17th. And what we saw initially was a rate of doubling every 2 to 3 days. For the first 10 to 12 days, we were doubling every 2 to 3 days. The last two doublings we've had have been in 10-day increments. So we went 10 days and doubled to about 80. And then the last 10 days, we went from 80 to 164. That's a good sign. That's what we want to see. It's partly due to the sheltering in place. I mean, this is why we're doing it. And the reason we're doing it, again, is to not tax the hospitals with so many patients. So as uncomfortable and as unpleasant as some of the sheltering is, and the social distancing we're asking people to do, this is why. We need to see this continued doubling spread out even more, and then we can get to a comfortable place, I think.
Right, and hopefully we can lift some of these precautionary measures. And the shelter in place is due to expire, I guess, in a little over a week. So we'll see what the health director determines at that point in time.
Correct.
But again, we have fewer and fewer cases on the peninsula itself. So again, good job staying away from each other.
Yeah,
So-
our big issue clearly is what we get a lot of calls on is the beach.
Yeah.
We have great weather right now. We're going to continue to have great weather. We will be out patrolling. We're going to be asking people to do social distancing. We'll be checking. We appreciate the help from our residential group that's going out as well,
Very
and
much,
they're
very
helping.
much.
It's very helpful to do the kind reminders to people. We have our signage. We're going to continue with the no parking at Del Mar and Scenic throughout the weekend and the end of the month, and then we'll probably extend that anyway.
Probably,
but
yeah.
we just have the signage till the end of the month. So again, we're continuing to push the effort of social distancing that way.
Awesome. Thanks, Chief. You're doing
Thanks.
a great job. I'm really
Thank you.
grateful to work with you. So, oh, my mother really likes you as well.
I need a haircut though.
Yeah, you really do. You really do. All right. Wash your hands in peace and friendship. Have a good weekend and
Take good care.
take good care.